Welcome back for another deep dive. Today we're going to try to tackle the world of child psychopathology.
Oh, wow.
It's a really fascinating area, but can also be pretty complex.
It can be very complex.
Trying to figure out if a child's struggles are just them growing up,
Right.
or if it's actually something more serious.
Mm-hmm.
That's a challenge a lot of clinicians face every day.
It is. Yeah, it's like being a detective,
Really?
You're gathering clues and you're trying to piece together a puzzle to figure out what's going on with
Yeah.
a child. And it's not just about, you know, giving them a label or something like that. It's about getting the full picture.
The whole picture of their life.
Yeah.
So let's dive into a scenario.
Okay.
We've got Felicia, 13 years old, and she's been refusing to go to school. She's been feeling withdrawn,
Mm-hmm.
and she's struggling with sadness.
Mm-hmm.
And to make things worse, her mom was recently hospitalized.
Oh, wow.
So Felicia's situation, I think, is a perfect example of why doing a thorough assessment
Mm-hmm.
is so important.
It is, yeah.
We need to figure out if what she's going through are normal reactions
Yeah.
to a stressful situation or signs of a deeper issue.
Exactly.
And I imagine it's not as simple as just asking Felicia a few questions.
No, it's assessment involves a lot more than just an interview.
Okay.
You really need to understand Felicia in her specific individuality, taking into account all of her unique circumstances,
Yeah.
her development, her family history,
Well,
even her cultural background. It all comes into play.
that makes sense. Every child is different. So, their challenges are going to be unique too.
For sure.
But how do clinicians actually go about gathering all that information?
But they've got a whole toolkit that they use.
Really?
And the foundation of that toolkit is the clinical interview.
Okay.
And that allows clinicians to hear directly from the child and the family about, their experience, their perspective.
So it sounds like a conversation,
Yeah.
but I'm guessing it's a lot more structured than just chatting.
Right. You're right. Yeah. While it is important to make sure it's comfortable
Yeah.
and an open environment, clinicians will use specific techniques
Okay.
to try to gather the information that they need.
Interesting.
So they might ask Felicia about, her development, her relationships, her school experience, her emotions, any big events that have happened in her life.
So they're trying to see Felicia's world through her eyes.
Precisely.
Now,
Yeah.
pick that.
And then there are behavioral assessments,
Well,
which
yeah.
are kind of like observation missions, right?
Okay.
So clinicians might use checklists or rating scales or even just direct observation to try to find patterns in Felicia's behavior
All right.
and also try to figure out what triggers it.
So like if Felicia's, refusal to go to school is worse on certain days.
Yeah,
Or in certain situations.
exactly. Yeah. It's about looking for clues to try to figure out what's going on.
That makes sense.
Yeah.
So we've got the interview, we've got the behavioral observations.
Yeah.
What other tools do we have in this detective kit?
Well, clinicians often use psychological tests
Okay.
to try to get some deeper insight into how a child is functioning.
Yeah.
So these tests can assess things like intelligence,
Mm-hmm.
personality, emotional well-being.
So like an IQ test?
Yeah, intelligence tests like the WISCV
Okay.
that can give us information about a child's cognitive strengths and weaknesses,
Right.
which can be really helpful when you're trying to understand things like learning disabilities.
Okay.
And then there are projective tests,
Okay.
which use ambiguous stimuli, like ink blots or pictures, to try to tap into a child's unconscious thoughts and feelings.
Those sound pretty intriguing. I've always wondered about those ink blot tests.
Yeah, they can be pretty revealing,
Yeah.
but you have to be really well trained to interpret them.
Yeah, I bet you wouldn't want to jump to conclusions based on a few ink splatters.
Right. Exactly.
Are there any other types of tests that are used?
Yeah, there are also neuropsychological tests that help us understand the connection between a child's brain and behavior.
Oh, wow.
These tests are really useful if you think there might be a brain injury
All right.
or some other neurological issue going on.
So it's like we're putting Felicia's brain under a microscope
Yeah,
to see if there's anything that's contributing to her struggles.
exactly.
Wow.
So by combining all this information, from the interviews,
Yeah.
the observations, the tests, clinicians can start to build this full picture of what's going on with the child.
It sounds like it's a lot of information to process.
It is.
How do they make sense of all of it?
Well, that's where the art of assessment really comes in. They have to go through all this data,
Yeah.
look for patterns, connections, inconsistencies.
Wow.
And they also have to consider, the child's age and gender and cultural background.
Right.
Because all these things can affect how we see behavior.
Yeah, you're right. A behavior that might be concerning in one culture could be totally normal in another?
Yeah, exactly. And that brings us to an important idea called cultural humility.
Cultural humility. Tell me more about that.
So it's about recognizing our own biases
Okay.
and being open to understanding the world through the child's cultural lens.
So not making assumptions based on our own cultural experiences.
Exactly.
Right.
Clinicians have to be sensitive to how a child's culture might shape their experience,
Right.
their beliefs, even their understanding of mental health.
Yeah, that makes a lot of sense.
Yeah.
So clinicians are gathering all this information, considering the child's background, and trying to make sense of it all. It sounds like a really fascinating process.
It is.
They're also complex.
Very complex, yeah.
Yeah.
And it's just the first step in trying to help a child like Felicia.
So what happens next? Once clinicians have gathered all this information, how do they actually use it to figure out the best course of action for the child?
Right. Well, that's where we kind of move from assessment to thinking about diagnosis and treatment.
Oh.
It's like we've gathered all these pieces of the puzzle.
Right.
Now we're trying to figure out what the picture actually looks like.
Yeah.
And then how to best address it.
So using all the information about Felicia, clinicians will try to figure out if her struggles meet the criteria for a specific diagnosis.
Right. But even the process of diagnosis can be pretty complicated.
Really?
How so?
Well, there are two main approaches that clinicians use.
Okay.
Categorical and dimensional.
Two different ways of looking at the same information.
Yeah, pretty much. Can you explain the difference?
Yeah, so the categorical approach is kind of like putting things into neat little boxes.
Exactly.
It relies on specific criteria
Yep.
that are outlined in the DSM-5TR
Right.
to determine if someone fits into a particular category, like major depressive disorder, for example.
Exactly.
So it's kind of like a checklist.
Yeah.
If you meet enough of the criteria, you get the diagnosis.
Right.
Okay, so then what's the dimensional approach? Well, the dimensional approach is more about looking at things on a spectrum.
Okay.
So instead of putting Felicia into a specific box,
right.
we would look at traits like anxiety or depression on a scale and
Yeah.
see where she falls.
Okay, so that seems like a more nuanced way of looking at it.
It can be, yeah.
Is one approach considered better than the other?
You know, it's a really ongoing debate in the field.
Okay.
Both approaches have strengths and weaknesses.
Okay.
The categorical approach can be helpful, I think, for communication and treatment planning.
Yeah.
But it can also feel a little bit overly simplistic.
Right.
Whereas the dimensional approach, I think, captures more of the complexity of human behavior, but it can be a little harder to use in practice.
Yeah, that makes sense.
Yeah.
So there's no one right answer when it comes to diagnosis.
Exactly. And just like assessment.
Yeah.
Cultural considerations are super important here.
Okay.
Clinicians need to be mindful of how cultural factors can influence how symptoms present and how we interpret diagnoses.
It's a good reminder that, you know, there's a human element to all of this.
Absolutely.
It's not just about checking boxes. It's
Yeah.
about understanding a child's experience with all of its complexities.
Exactly. And once we have a better understanding of what's going on,
Yeah.
we can start to think about what the best treatment would be.
This is where things get really interesting for me.
Really?
There are so many different types of therapy out there.
There are.
How do clinicians decide what's best for a child like Felicia?
Well, you're right. There is no shortage of treatment options.
Right.
And just like with assessment and diagnosis,
Yeah.
it's not a one-size-fits-all approach.
Okay.
The choice of treatment really depends on a whole bunch of things.
Yeah.
Including, you know, the child's needs, the family's preferences,
Right.
the clinician's theoretical orientation. It all plays a part.
Okay, so walk me through some of the options.
Sure.
What are some of the most common types of therapy that are used with children?
One that's used pretty widely is cognitive behavioral therapy. Yeah, or CBT.
I've heard of that one.
Yeah, it's all about changing those negative thought patterns.
Okay, yeah.
CBT basically helps children identify and then challenge those unhelpful thoughts and behaviors that are contributing to their difficulties.
Yeah.
It's about learning new skills and strategies to cope with things and improve their emotional well-being.
So it's kind of like giving them a toolbox full of coping mechanisms.
That's a great way to put it, yeah.
I like that.
Another approach that's really common is play therapy,
Okay.
which is especially helpful for younger kids.
Play therapy. I've always been curious about that one.
Yeah.
How does that work? Do kids just play with toys and magically feel better?
It's not quite magic,
Okay.
but it can feel like that sometimes.
Right.
Play is a really natural language for children.
Yeah.
And through play, they can express and process emotions that they might not be able to put into words.
So it's like they're communicating through their toys.
Exactly.
Yeah.
So the therapist observes their play, helps them work through difficult emotions,
Okay.
and just provides a safe space for them to try out different ways of coping with challenges.
That makes sense.
Yeah.
What other types of therapy might be helpful for a child like Felicia?
We might also think about family therapy, which
so.
focuses on improving communication
Yeah.
and the dynamics within the family system.
So it's about recognizing that a child's difficulties don't exist in isolation.
Precisely.
Okay.
Family therapy really helps families understand how their interactions
Yeah.
might be contributing to the child's struggles and then work together to make a more supportive environment.
That seems really important, especially in a situation like Felicia's, where there's been a lot of family stress.
It is.
Are there any other approaches we should talk about?
Yeah, there are a couple more that are worth mentioning.
Okay.
One is called psychodynamic therapy,
Okay.
and it focuses on trying to uncover unconscious conflicts that might be driving a child's behavior. It often involves exploring early childhood experiences,
Wow.
relationships.
That sounds like it could be really insightful,
It can be, yeah.
but also potentially intense.
It can be, yeah, and it's not always the right fit for every kid.
Right.
Another approach is client-centered therapy, which is really about creating a supportive environment and a non-judgmental environment for the child to explore their own thoughts and feelings.
So it's about empowering the child to find their own solutions.
Exactly. The therapist acts as more of a guide,
Okay.
helping the child develop self-awareness
Yeah.
and tap into their own strengths and resources.
Wow, we've covered a lot of ground here.
We have.
It seems like there are a ton of therapeutic approaches available.
There are a lot, yeah. And we haven't even talked about neurobiological treatments,
Right.
which use things like medications or other biological interventions to try to address underlying neurological factors.
Yeah. Medication can be a really important part of the treatment plan for some kids.
It can be, yeah.
So with all these options, how do clinicians decide what's the absolute best approach for a particular child?
It's a process of really careful consideration and collaboration. Clinicians take into account all the information they gathered during assessment.
Right.
The child's needs and preferences, the family's input, and of course, the latest scientific evidence on what treatments work best for what conditions.
It's like putting together a personalized treatment plan
Yeah,
tailored to the individual child.
that's a great way to put it. And just as we've discussed with assessment and diagnosis,
Right.
cultural considerations are super important in treatment planning as well.
Yeah, making sure the treatment approach is sensitive to the child's cultural background.
Absolutely. It's about creating a safe and respectful environment
Yeah.
where the child feels understood and supported.
Okay, so we've talked about assessment, diagnosis, treatment.
We have.
What else is important to think about when we're dealing with child psychopathology?
I think it's important to think about the bigger picture, too.
Okay.
You know, we can't just focus on treating individual cases.
Right.
We need to think about preventing these things in the first place.
So trying to catch them early.
Exactly. Yeah, early intervention is key.
Yeah.
Imagine if we could identify kids who are at risk for mental health difficulties early on
Right.
and provide support so things don't escalate.
That sounds ideal.
Right.
How do we actually do that, though?
Well, there are some promising approaches out there.
Okay.
One is to implement universal screening programs in schools.
So we'd be screening every child for potential mental health issues.
That's the idea, yeah.
Wow.
Of course, screening is just the first step. It's
Right.
not about labeling kids.
Right.
It's about figuring out who might need some extra support.
Connecting them with the resources they need.
Exactly.
Okay.
Another important thing is to increase mental health literacy
Okay.
in the general population.
So helping people understand what mental health is, how to recognize warning signs, and where to go to get help.
Exactly. The more we can normalize these conversations,
Right.
the less stigma there will be.
It makes sense if we can make it easier for people to talk about these issues.
Yeah.
They'll be more likely to get help
Exactly.
when they need it.
And of course, we need to make sure that those resources are actually available.
Right. Because there's no point in identifying kids who need help
Right.
if there aren't services out there to help them.
Exactly. We need to invest in making mental health care more accessible,
Yeah.
especially in communities that have been underserved.
Okay. So it's kind of a multi-pronged approach.
Yeah.
We need to think about prevention, early intervention, reducing stigma, and increasing access to care.
It's a big challenge, but it's one we have to face.
Yeah.
You know, the mental health of our children is crucial.
Absolutely. So this brings us back to Felicia.
Mm-hmm.
Knowing all of this, what are some things we should be thinking about with her case?
Well, I think first and foremost, we need to remember that Felicia is an individual.
Right?
She's not just a set of symptoms or diagnosis.
Yeah, her experiences are unique,
Yeah,
and her treatment plan should reflect that.
absolutely. We also need to think about everything that's going on in her life.
Right.
Remember her mom was recently hospitalized?
Yeah.
It's a huge stressor.
Yeah, it's a good reminder that mental health issues don't just happen in a vacuum.
Right.
They're connected to all sorts of other challenges and life events.
Exactly. So we need to figure out how to support Felicia and her family during this tough time.
And how can we make sure she gets the best care possible?
Well, that's where collaboration comes in.
Oh, for
Between clinicians, families, and communities.
So it's not just about individual therapy.
Right.
It's about creating a supportive network for Felicia.
Exactly. And that network might include, her family, friends, teachers,
Mm.
other professionals who can offer guidance and resources.
It's a good reminder that we all have a role to play in supporting kids' mental health.
Absolutely.
I think that's a great message to end on.
Yeah.
We can all make a difference by being informed, compassionate, and proactive
Oh, sure.
when it comes to child mental health. So thank you so much for joining us for this deep dive.
My pleasure.
It's been a really fascinating conversation.
Yeah.
And hopefully our listeners now have a better understanding
I hope so.
of all the complexities of child psychopathology.
Mm-hmm.
And to our listeners, keep exploring this topic.
Yeah.
The more we know about child mental health, the better we'll be able to support the kids in our lives.
I agree.
Thanks again for listening.